Are hand sanitizer lotions effective? You already know that keeping your hands clean is one of the best ways to keep yourself and others around you healthy. Plain old hand washing with soap and water is most effective at fighting germs, as the Centers for Disease Control and Prevention (CDC) notes. When you're on the go, hand sanitizer made with at least 60% alcohol is a good stand-in. Hand sanitizer remains important because it helps remove germs from your hands, so that they do not end up on your face, explains Jeffrey Cohen, MD, board-certified dermatologist and assistant professor at Yale School of Medicine in New Haven, Connecticut. But if you regularly use hand sanitizer, you know that this hygiene product comes with an unpleasant side effect: dry, cracked skin. Now, though, thanks to a host of new products in drugstores, you may be able to take this hygiene routine from 2 steps to 1, or at least use less moisturizer after sanitizing your hands. The alcohol in hand sanitizers can have a drying effect on the skin. Joshua Zeichner, MD, Associate Professor of Dermatology and Director of Cosmetic and Clinical Research in Dermatology at Mount Sinai Hospital in New York City. For those with eczema and others with sensitive skin, the skin barrier is already compromised, increasing inflammation and causing or worsening symptoms including dryness, redness, flakiness, and irritation, notes the National Eczema Association. Therefore, using hand sanitizers without moisturizing the skin afterward can worsen symptoms of eczema on the hands. The latest generation of hand sanitizers are truly a hybrid between skincare and disinfectants, Dr. Zeichner says. For tips for choosing a quality moisturizing hand sanitizer: to pick a product that cleans and restores moisture to the skin, turn your attention to the ingredients list and follow these expert tips. 1. Eyeball the alcohol type and concentration. I always look for ethyl alcohol, which is more effective than isopropyl alcohol at killing microorganisms, says Karen Lal, MD, a board-certified dermatologist at Schweiger Dermatology Group in Hillsborough, New Jersey. While sanitizers with an alcohol concentration between 60 and 95% are more effective at killing germs than those with a lower alcohol concentration or a non-alcohol-based hand sanitizer, per the CDC, sticking to a sanitizer on the lower end of the scale is better for your skin. I would avoid very high concentrations, more than 85%, of alcohol because they are more drying, Dr. Lal says. I always look for ethyl alcohol, which is more effective than isopropyl alcohol at killing microorganisms, Dr. Lal says again. Separately, be wary of potentially hidden methanol content in certain sanitizers. In July 2020, the Food and Drug Administration (FDA) noted on its website that some products imported from Mexico were found to be contaminated with the ingredient, which was mislabeled as ethanol. Methanol is toxic, and its absorption can have serious health consequences including blindness and death, Lal says. The FDA urges consumers to pay attention to the ingredients labels on such products, and to avoid using any products specifically known to contain methanol, which the agency lists on its website. 2. Consider benzalkonium chloride. If you have sensitive skin, consider a non-alcohol-based hand sanitizer. Benzalkonium chloride is one option, as it's an antiseptic agent that has been found to deactivate COVID-19. Nonetheless, it doesn't kill as many infectious microorganisms as alcohol, Lal says. A study published in February 2021 in the Journal of Hospital Infection found that benzalkonium chloride deactivates COVID-19 on both hands and surfaces. Researchers noted several advantages of using it over alcohol for hand disinfection, including that it has several advantages. They also pointed out that healthcare workers may be more likely to engage in better hand hygiene practices with benzalkonium chloride hand sanitizer because it has fewer side effects than alcohol-based sanitizers. 3. Identify products with moisturizing agents. In terms of inactive ingredients, LOL looks for squalene, glycerin, and coconut oil, all of which help attract water and maintain moisture. Nazanin Saedi, MD, Department Co-Chair of the Laser and Aesthetics Surgery Center at Dermatology Associates of Plymouth meeting in Pennsylvania, agrees, noting that glycerin is the main ingredient she looks for in moisturizing hand sanitizers. 4. Avoid fragrance. This tip is key for people with eczema and anyone managing sensitive skin, as fragrance can be irritating, says Dr. Saedi. It goes back to that compromised skin barrier that Zeichner mentioned earlier. Fragrances can be irritants, Saedi says. Thanks for watching.